We're going to talk about women's hormones. So I see a lot of people who say that they have had their hormones checked by their gynecologist, but a lot of times they've only just had a random untimed screen, and their hormones were only interpreted according to the range that the lab gives, which actually is not helpful at all for trying to improve health or how we feel. So when we look at hormones, we actually want to do timed draws. There's 2 times of the month that it's really helpful. And we want to look at not only the active circulating hormones, but we want to look at the brain hormones that are signaling down to the ovaries. We can actually see if someone's in perimenopause or where you're at on the menopause journey with those. We can check for things like PCOS. And then we also want to think about master precursor hormones and more indirect, what I think of as more peripheral hormones if we're having things like acne. So there's a ton to look at in hormones, and it's not just what is the marker, it's what is the marker based on what time of the month it is, and also what is the marker in relation and ratio to your other hormones. All of these together inform the big picture, and we have to look at these to know where to supplement, where to boost things, where to come in, and we have to think about other things like cortisol that can be influencing our hormones too. I'm Dr. Rachel. I help a lot of women with hormones, and I help people with chronic inflammation and infertility as well. And I think hormones is a really big missed part of helping people feel better.